All right, it's time that we updated this video to go over how Medicare and health savings accounts work together, or don't work together might be a better way of putting it. If you are eligible for Medicare and have an HSA, you're going to want to know what's coming up. Quite often the decision to stay on your company insurance plan or switch to Medicare boils down to the health savings account, or HSA. Millions of Americans have an HSA and are Medicare eligible, and misunderstanding the rules Medicare has around HSAs could result in you having to pay extra taxes and penalties. Once you have any form of original Medicare, whether that is Part A only or both Part A and Part B, neither you nor your employer may contribute to your HSA. Now, depending on your company, this could be a substantial amount of money that you receive each year from your employer, and it may affect whether coming off of your company insurance and switching to Medicare is a wise financial decision for you. Now, when you decide to go on Medicare affects when you should stop your HSA contributions. And it all boils down to your effective date for Medicare. Here's the official verbiage from Medicare.gov. If you're 65 or older, your Part A coverage will start up to 6 months back from the date you sign up for Medicare. This means it will go back 6 months or your 65th birthday, whichever is closer. Let's clear that up a bit with some examples using my trusty whiteboard. There are 3 main scenarios to discuss here and 2 other important points. The first scenario is if you are going on Medicare at your 65th birthday and your Medicare start date or effective date is your 65th birthday month. Medicare effective dates are always the first of the month. So if your birthday is in April, let's say that it's April 30th, your Medicare start date would be April 1st. This means that you and your employer can make your last HSA contributions in March and then stop those contributions so that you are not making them from April onward. Now, you may think to yourself, well, I'll just outsmart the system and I'm going to make my full year's worth of HSA contributions before my birthday month. I like how your mind works. However, this is not allowed. You cannot front load your HSA contributions. You can make the prorated contributions for the number of months you are allowed to contribute. In this example, the family HSA max contributions for 2023 are $7,750 per year. Also, if you're over 55, which in this case we are if we're taking Medicare, you can contribute an extra $1,000 per year as what are called catch-up contributions. So we would take the $7,750, add the $1,000, and then you would divide that by the 12 months in the year. You're able to make $729.16 worth of HSA contributions per month. And in our example, that means January, February, and March for a total of $2,187.50 worth of HSA contributions may be made in this year by any combination of your own contributions and your company's. Now, with this example, if your birthday is on the first of a month, so instead of April 30th, it is April 1st, your Medicare effective date becomes the first of the month prior to your birthday month. In this example, your Medicare effective date would be March 1st, and then you and your employer would need to stop making HSA contributions before March 1st, meaning February is the last month that you may contribute. And again, prorating that amount by dividing your maximum contributions limit by 12 and adding the number of months allowed. In this case, it would be 2. Okay, so scenario number 2, you decide to take Medicare just after your 65th birthday. Say you're 65 years and 4 months old. Remember that your effective date will be 6 months back from when you sign up, or your 65th birthday month, whichever is closer. In this case, your 65th birthday month is closer than 6 months, so your Part A effective date would again be April 1st in our little example here. Same as before, you would need to stop contributions before April 1st. All right, the last example is if you delay Medicare past 65 because let's say you're working and you're covered by your company's plan. So let's say that you are 67 years old and you are going to start Medicare during your birthday month, again, April. Things here get a little tricky. Medicare.gov places your Part A effective date as 6 months back from when you sign up for Medicare, not 6 months back from your birthday month. So if you know you will lose coverage from work on April 1st, you will need to start the Medicare process in signing up for that in around January. Our site is 90 days from retirement. So 90 days before you need it, you start that process. This means that if you complete that process in January, your 6-month look back puts you back at July of the previous year as when you need to stop making HSA contributions. If you didn't, things get complicated with your taxes, assuming you already filed for the previous year. So this is one of the many reasons that we always recommend working with an agent around your Medicare decisions, and especially as it relates to your HSA. Similar to the previous scenarios, your previous year HSA contributions will be prorated for the number of months that you're allowed to make contributions. You cannot front load your HSA. All right, the two other important points that come from questions that we get asked frequently. Number one, what if you retire before 65? Can you still contribute to an HSA until you reach 65 and then go on to Medicare? The answer is yes. As long as you're on a qualified high deductible health plan, you can contribute to your HSA up until you go on to Medicare. So if you're on a high deductible health plan through the marketplace, as an example, you can continue to contribute to your HSA. Stop contributions according to what we've covered in the scenarios above. The second common question is, well, what if my spouse is older or younger than me and one of us goes on Medicare while the other one stays on our high deductible health plan through work? If this is the case, the one that is still on the high deductible health plan through work may continue contributing to the HSA as well as the employer. Now, the contribution amount depends on how your work health plan is set up for you. There is the individual HSA contribution limit per year and a higher family limit. If you are on a family plan through work, either because you have a dependent that you are covering on your plan, or you and your spouse are still covered on the plan, your spouse just happens to also be on Medicare, then you may continue contributing at the higher family HSA limit. If your health insurance plan through work is set up to only cover you as an individual policy and not a family policy, because you either do not have dependents or your spouse is only on Medicare and your spouse is not on the plan with you, then you may contribute the individual HSA limit, not the family limit. Another common question that we get is, how can I use my HSA dollars once I go on to Medicare? Now, you've saved and accumulated these dollars for a long time, so how are you able to spend them to avoid penalties? Well, the good news is that HSA dollars may be used for qualified medical expenses just like they were previously. However, there is one exception that many people aren't fully aware of. HSA dollars are your dollars, and you may use them for your Part B premiums, your Part D premiums and copays, your Medicare Advantage plan premiums if you have them, and any copays. They can be used for dental and vision premiums and copays. However, HSA dollars may not be used to pay for supplement plan premiums. They're also known as Medigap plan premiums. And I get it. It should be allowed from a knee-jerk reaction and common sense perspective, but it is not. And supplement plan premiums are higher. And so this is often causes a little bit of concern. Now, you can use your HSA dollars to pay for the Part B deductible if you are on a supplement plan G, as an example. You can use your HSA dollars to pay for the copays of, say, a plan N, and you can use your HSA dollars to pay for the deductible of a high deductible plan G. You just can't use them to pay for the premiums of the supplement plans. All right, the last thing I'll cover in this video is the flex spending accounts, also known as FSAs. FSAs do not follow the same Medicare rules as HSAs. Someone who is Medicare eligible is able to have an FSA and contribute into an FSA while on Medicare Parts A or B and actively employed. Hopefully this helps shed some light on how Medicare and HSAs work together. Whether you just recently started contributing to an HSA or you've been diligently contributing to an HSA for years, the government has specific stipulations around what you can and cannot do with your HSA. If you have any other questions around your HSA or FSA, reach out and we're happy to help. If you found this video helpful, I'd really appreciate you joining our friends who subscribe to this channel to stay up to date on all things Medicare. A classic like helps our channel a lot, as does a comment, so I'll throw that out there. You do what you feel is best. All right, that's all I got. I appreciate you and thank you for watching.